Good afternoon, students. Now we are going to show you some of the specimens of infratemporal region, in which we are going to show lateral pterygoid and medial pterygoid and the distribution of maxillary artery. Then we are going to show you the masseter muscle, and remaining two specimens we are going to show you about the sagittal section of the pharynx, which you had learned today in gross anatomy. So if we start here with our first specimen here, base of mandible, and see how beautifully this has been dissected. This is mylohyoid muscle, and as mylohyoid muscle forms the oral diaphragm. Origin of mylohyoid we know, we have discussed it, anterior, middle and posterior fibers, or it is called superior, middle and inferior fibers. Mylohyoid line of the mandible. Then insertion into the median raphe of the mylohyoid, and the lowermost fibers are inserted into the body of the hyoid bone. So therefore these fibers from the right and left side, they will form a median raphe like section, and they will form a diaphragm like structure. So this is the mylohyoid muscle. Nerve supply now to mylohyoid, and this muscle belongs to which group? It belongs to the suprahyoid group of muscles. What are the suprahyoid group of muscles? Digastric, stylohyoid, mylohyoid, geniohyoid. So therefore this is our mylohyoid muscle. Then we come over to this beautiful specimen. If you can see this here, exclusively masseter muscle is there. See how beautiful this masseter muscle has been dissected out to prepare this specimen. Here this is zygomatic arch. As we had discussed, origin of masseter, superficial fibers, middle fibers, deep fibers, or they are called anterior, middle and posterior fibers. The anterior fibers or superficial will take origin from anterior 2/3 of the lower border of zygomatic arch. Similarly, and see the direction. The direction of the fibers will be directed downwards and backwards. Then middle fibers. The middle fibers, here you are able to appreciate the middle fibers, which are from posterior 1/3 of lower border of zygomatic arch. They are vertical. And similarly, behind the middle fibers, deep to it, from the deep surface of zygomatic arch will be the deep fibers. They are also directed downwards and forwards. So in short, the masseter muscle is in the form of a cruciate. What will the nerve supply? Nerve to masseter. What is the insertion of masseter? The insertion of masseter will be on the lateral surface of the ramus, that is the angle of the mandible. And what will the anterior fibers do? What is the action of anterior fibers? It will pull the body of the mandible upwards, and it will also help in the protraction of the mandible. Similarly, the vertical fibers from the middle and posterior fibers will help the mandible in retraction. And now to masseter, it is a branch of course, mandibular nerve. We come over here. This is again another example. It's a very, very meticulously dissected out specimen for lateral pterygoid, where the pen is there, indicator. I am indicating the lateral pterygoid muscle. On the lateral pterygoid, you are able to beautifully see the maxillary artery. See how it is going inside. It will pass in the pterygomaxillary fissure between the two heads of lateral pterygoid. What are the two heads of lateral pterygoid? Upper part and lower part. Upper part of lateral pterygoid will take origin from infratemporal surface and crest of greater ring of sphenoid. Lower part of lateral pterygoid will take origin from the lateral surface of lateral pterygoid plate. What is the insertion? See the insertion also. Here we are able to see this insertion. And this is the neck of mandible, pterygoid fovea. So number 1, lateral pterygoid inserted in pterygoid fovea. Number 2, it is inserted in the capsule of TM joint. And number 3, it will be inserted into the articular disc, which will be present in TM joint. Above that, on the superficial aspect of lateral pterygoid, there is maxillary artery. And deep here, now see where the indicator is there. This is medial pterygoid muscle, deep. This medial pterygoid has two heads, superficial and deep. And superficial head will take origin from tuberosity of maxilla, and deep head from the deep surface of lateral pterygoid plate. Insertion, see the fibers which are going downwards and backwards, they are inserted into the deep surface of the ramus of mandible. That is also called angle of mandible. And on superficial or on the surface of medial pterygoid, you are able to see these two nerve bundles. The first nerve bundle is lingual nerve. Second nerve bundle will be inferior alveolar nerve and vessels, which will pass in the mandibular foramen. So here, these are the three specimens of the temporal and infratemporal region.